Pediatric Transport. All ambulances should have seats and restraints appropriate for securing children from newborn on up. All child seats/restraints in ambulances should be tested. Child seats and restraints should only be attached to cots. Child seats and restraints should only be attached to seating positions that pass the appropriate standard when tested as a system together. A child passenger, especially a newborn, must never be transported on an adult's lap. It is not appropriate to transport children, even in a child restraint system, on the multi-occupant squad bench located in the patient compartment of ground ambulances. NHTSA recommendations for a child who is uninjured or not ill. Transport for the child in a vehicle other than an emergency ground ambulance. When other transportation is not possible or available, transport in a size-appropriate child restraint system. NHTSA recommendations for a child who is ill and/or injured. For a child who is ill and/or injured, and whose condition does not require continuous and/or intensive medical monitoring and/or interventions, appropriately secure and transport the child on the cot in a size-appropriate child restraint system. For a child whose condition requires intensive medical interventions, appropriately secure and transport the child on the cot in a size-appropriate child restraint system. For a child whose condition requires spinal immobilization, secure the child to a size-appropriate spine board. Secure the spine board to the cot, head first, with a tether at the foot if possible, to prevent forward movement. Use 3 horizontal restraints across the torso, chest, waist, and knees. Use a vertical restraint across each shoulder. Multiple patient transport, newborn with mother. For a mother and newborn, transport the newborn in an approved size-appropriate child restraint system, in the rear-facing EMS provider seat that prevents both lateral and forward movement.